Thank you. Welcome to our channel. My name is Kenneth Olka. I understand that some of us are still struggling with the basics of ECG. Today, I want us to look at the characteristics of a normal ECG paper strips, as well as characteristics of the waves. In that way, it will help us to understand ECG. All right, ECG is a standardized grid used to record electrical activity of the heart. It consists of small and large squares, each of which measures specific time and voltage and the ECG rhythm. The horizontal axis represents the time, whereas the vertical axis represents the amplitude or the voltage of the electrical current. The standard ECG paper speed is 25 millimeter per second. I don't want you to make mistake of calculating rate without first of all looking at the bottom of the ECG paper to know the speed. There are some other configurations like the 50 millimeter per second. So if that is the case, then you know that the method for calculating your rate is going to change. Each small square represents 0.04 second, whereas one large square represents 0.2 seconds. So 300 large squares cover a period of 1 minute. So this is the basis for dividing 300 by the total number of large squares between RR interval. Remember, the vertical axis measures the amplitude of the heart's electrical current. So 10 millimeter in hertz equals to 1 millivolt. Therefore, 1 millimeter represents 0.1 millivolt, and each large square represents 0.5 millivolts. In our previous lectures, we discussed what each wave or the segment of the wave represents. The P wave represents arterial contraction, the QRS complex represents ventricular contraction, the PR segment represents a pause or a period of delay between impulse transmission from SA node to AV node, whereas T wave represents ventricular relaxation. You will not see arterial relaxation between it is hidden under the large QRS complex. Remember too the durations and the measurements of these various segments, because you will need it to determine the normality or otherwise of ECG. For instance, you can't talk of first degree heart block without talking of elongation in the duration of the PR segment, which is usually over 0.2 seconds. Remember too that there are some other uncommon waves that you might encounter. For instance, the Q wave represents the left to right depolarization of the interventricular septum and is usually seen in the left-sided leads like the leads 1, AVL, V5, and V6. You can also see S waves, which represent the final depolarization of the ventricles, as well as the U wave. U wave, we usually see it in cases of electrolyte abnormalities, especially in cases of hypokalemia. If you love this, follow us for more.